Muslim Aid was established in 1985 in Ethiopia from the back of the famine from 23 well-respected individuals and organizations in the UK. Consequently, since then, we have continued to work in Ethiopia in different capacities, but this is the first time we have come on a surgical medical mission. This mission came about from utilizing local partners, speaking to the Ministry of Health and speaking to a team of surgeons from multiple countries.
Ministry of Health have invited us here to visit the medical director of the Alert Hospital with the coordination with the Ministry of Health to look at the waiting list and how we can help.
What we already identified with the Ministry of Health is these subspecialities. So we put this team together on the back of speaking to the ministry and understanding the subspecialities that needed within the country. The medical team are highly qualified surgeons, and they have an understanding before they come on a mission like this to Ethiopia that they sit down and they talk and they address any concerns that they have.
You start about the shark using.
Yeah, we showed up here in Ethiopia on. So we got a little bit rest, then we joined the meetings with the Ministry of Health. We prepared everything so we can start on weekend stay here in Ethiopia. So we have a good facility here and they are very cooperative with us here in the Ministry of Health.
This lady is from countryside, suffering from this huge goiter for the last 10 years. The health access for her was difficult, so the Ministry of Health managed to bring her and we evaluated her first day before her surgery because she is from area where they don't have to have pharmacy in that area. So with doing one side and keeping her away from all her symptoms, in the same time keep her away from the need to have lifelong medication. So we have selected this because of the setup for the situation of the patient herself.
የእንቅርት በሽታ ታማሚ እኛ እንድድን ነው የመጣሁት። እያየሁ ነው እንደው ተሰውነት የተረብሻል። አንተ ለመመለስ ራሱ እኮ አቅቶኛል። ያው ደረስኩ እንግዲህ ታከም ነው የምፈልገው እንድድን። ሌላ ምን የምለው ቃላትም የለኝም። እንደው አታስጨንቁኝ ምን ያረዳል።
If you notice, Asma, she had two goiter, one in the right and one in the left. So we did the surgery for the left side and we lift the right side. So post-operatively might you notice a little bit there is swelling on the right side. Usually we lift these things because the patient post-operatively they need the medication for whole life. So if we lift the remnant of the thyroid, right, like Asma on the right side, so might it help her to prevent any using any medication later on.
So this is the incision. She has a very nice wound. Tell her she will be fine. She will not need thyroxine because we kept for her in a small thyroid. She can have a shower after 2 days with this oven and just dry it.
Okay. Thank you very much.
Oh, my pleasure. My pleasure. Thank you. Good luck, inshallah.
The medical notes of the patients are given to the surgeons beforehand so they can have a debrief in their particular countries. So there was many Zoom meetings, many Teams meetings and so forth.
ከጀመረኝ 6 ወር ሆኖኛል። ከዛ በኋላ የጨመረ በሽታው የተለያየ ነገሮችን ማስከተል ጀመረ። እግሬን አለመንቀሳቀስ እጅ አለመንቀሳቀስና እንደገና ሽንት ብሎክ የማድረግ እንደዚህ አይነት ነገሮችን አመጣብኝ ማለት ነው። እና እዚህ ጋር በድንገተኛ ተጽፎልኝ መጥቼ ቲሰር ተደረገልኝ። ይሄ የሽንት ማሸኛ አደረጉልኝ። የታለ ጎማው የታለ? ኦኬ ይሄንን አደረጉልኝ እና ከዛ በኋላ ተንፈስ አልኩኝ። ይሄኛው በጣም ኃይለኛ ሽታ አለው። ከሰው ጋር ተገልዬ ነው የምኖሩ። በጣም እፈልጋለሁ ለእንደዚህ ለተቸገሩ ሰዎች እንደዚህ ላጡ አቅም ለሌላቸው ሰርቶ አሁን እኔ አቅም የለኝም። በአሁኑ ሰዓት እኔ አቅም ስለሌለኝ ሰርቼ ገንዘብ አጠራቅሜ የመታከም እድሉ የለኝም። ስለዚህ ለእነዚህ እንደዚህ በጎ ኸይር ነገር ለሚሰሩ አላህ ጀዛቸውን ይክፈላቸው።
ችግር ነው። ሽንት ቤት መውሰዱ ምኑም አመቺም አይደለም። የሽንት ቤት መቀመጫው ምኑም ከባድ ነበረ። አልሐምዱሊላህ አልፈነዋል እና አሁን እዚህ ደረጃ እንግዲህ ወላሁ አለም አላህ ነው የሚያውቀው። እኛ ከአላህ ጋር በተስፋ የተሻለ ጤንነት ይዞ እንደሚወጣ እመኛለሁ። ከአላህ በታች ማለት ነው። እሱን እመኝለታለሁ እንግዲህ
It has been 2 years since we established urology unit in Alert Hospital. We have been able to see 4,500 patients by one urologist. And unfortunately, because of the lack of urologists and medical equipments, we are able to do surgery only 3 patients in a week.
What do we need to help more patients and decrease the waiting?
So what we need is endourological instruments which lead us or which provides us non-invasive surgeries, short hospital stay, and a lesser pain to the open surgery. So if you have these instruments, we can able to operate more than 30 per a week. Endourological instruments is a basic instrument for urology specialists.
Yes, yes.
And as I said, it's a less invasive surgery,
Yes.
so we can do more than 13 patients in a week. So this is an instrument which able you to do more than like.
In the total cost, it is more cost effective because you will do more cases in shorter time,
Yes.
less bed utilization, less
Yes.
pain,
Yes.
and less complication.
Yes.
Thank you very much, Dr.
Thank you. Thank you.
አሁን በቃ አልሐምዱሊላህ
Brother Gabruddin, he had his prostate removed yesterday. It's open surgery in this country because they do not have the equipment necessary to do this quicker. This surgery takes a lot longer, it's open to more infections and it's problems, especially for the patient. But alhamdulillah, we can see the surgery went well. Gabadin, how are you?
Alhamdulillah.
You good?
Yes.
Alhamdulillah,
Yes.
alhamdulillah.
Alhamdulillah.
And all he has been saying is alhamdulillah, thank you, thank you, thank you. So my friends, my families, my brothers and sisters, give whatever you can so we can keep the smile on people like this moving forward.
አባት
አቤት።
እንዴት ነው ኮኦፕሬሽኑ በኋላ?
በጣም አልሐምዱሊላህ በጣም ደህና ነኝ።
ምን ይሰማዎት?
ምንም ነገር የሚሰማኝ ነገር የለም። ያው ሄጄ ተንቀሳቅሻለሁ፣ ምግብ በልቻለሁ፣ አሰርቻለሁ። በጣም ደግሞ ማታ በጣም ሰላማዊ እንቅልፍ ተኛሁ
ነው።
እኔ ምን ብዬ እንደማወራ ግራ
አመስግኗቸው።
በጣም አላህ ከሰማይ መላእክት እንዳመጣ ጠቅላላ ጉሩባቸውን ጠቅላላ
And all of you.
ጠቅላላ
You also thank you.
This mission has evolved since the time we've been here. Initially, we only were working in Alert Hospital. And then we had a conversation with Hamlin Hospital, established over 65 years in Ethiopia. So we split our surgical team from gynecology, from the fistula team, going over to the Hamlin Center.
This hospital has been established more than 65 years now. Our founders, Drs. Catherine and Rage Hamlin, came to Ethiopia in 1959. Their purpose was to establish a midwifery school, but it so happened that they encountered a lot of fistula patients in that hospital, and they decided that they should stay and treat these patients.
Every day we are taking care of patients, and patients are being cared at outpatient department, and there could be cases that we get consultation. Otherwise, we are having nurses and a medical doctor who is handling the cases at outpatient department. But then once patients are get admitted, we need to reevaluate them and making sure that they are properly diagnosed with the conditions that they are having and investigated with the protocols. Then after making a diagnosis and set a scheduled day of their operation, and by the time they are going to have the surgery, we are having 4 doctors in this hospital, and 2 of us urogynecologists and 1 general gynecology specialist and 1 urologist. So we are going to do surgeries in the OR, depend on the condition of the woman. Then after post-operatively, we are the one who is going to follow them with, there are trained professional medical nurses, and all these activities belongs to me.
ቀርቶ እንግዲህ ተያዘኝ 1 አመት ይሆነኛል እና ካርድ ያስገብቼ ቆይቻለሁ። አሁን በአቅም ስለሌለኝ እንደውም ማሳልፌው ነበር። ተጠርቼም ማሳልፌዋለሁ። አሁን እንደገና ተጠርቼ ስጠራኝ እንደውም ማረባክሽ ይለፈኝ ምንም የለኝም ስላት በኔ ይሁንብሽ አሁን ተገባሽ ምንም አይደለም ነይ ዝም ብለሽ አለች። እንደዛ ስትለኝ ነው የመጣሁት እንጂ አሁንም ላሳልፈው ነበር ምንም አቅም ስላላለኝ ማለት ነው። ኦፕሬሽኑ በኋላማ እንግዲህ ተሻለኝ ነው ምን እጠብቃለሁ። ያው ከኔ ምን አውቃለሁ እንግዲህ ከዲያንኩኝ ያው ሲድን ነው ማመሰግነው እንግዲህ።
Surgical mission is not easy to get people on the board to come here, but we managed to have very experienced anesthetists, very important. We have got very good experienced professor of subspecialty in the fistula, so it is very happy moment to see all these experience coming together and help our colleagues in the local team in the local hospital.
እና ይህን እድል በማግኘቴ በጣም እጅግ አድርጌ ነው ያመሰግንኳችሁ። ይህንን ድርጅት በጣም አመሰግነዋለሁ። ሲስተር ጥህለን ጨምሬ በጣም ነው የማመሰግናቸው።
We have been relying on funds that are coming from across the globe, from different partners, and many of them are individual donors, and some of them are corporate or organizational donors and foundations. Since we are providing a holistic care, which includes not only the surgery, but also the follow-up on rehabilitation, physiotherapy, and psychosocial support. And this holistic support requires a lot of funding and resources.
እኔ 2 ወር 15 ቀን ተቆይቻለሁ። አዎ ልጅ ምክንያት የተወለደ ጊዜ እሱ በቃ 6ኛ ዓመት አሁን 7ኛ ዓመት አልፏል። 6ኛ ዓመት ቆይቼ በቃ አሁን እግዚአብሔር ይመስገን እዛ መጥቼ አሁን እዚህ ሁሉ ነገር አሁን ተመችቷል። እኔ ድናለሁ፣ ድንቼ እሄዳለሁ። ሌላ ነገር እግዚአብሔር ይመስገን እዛ ሆስፒታልን በጣም ተመችቷል። ደስ ያለ ሁሉ ነገር የእናቱን አባቱን ይበልጣል። እግዚአብሔር ታች በጣም ደስ ያለ።
This is a patient who is having fistula repair previously, but still leaking urine. Such a kind of patients, we call them post-fistula closure urinary incontinence. The continent mechanism looks good now, but she developed surgical site wound infection. So we are managing that surgical site wound infection with antibiotics, wound care, and as well even we do real laparotomy to make sure that she is going to be good again.
Nowadays, we are able to operate on like 3,500 patients each year in all our centers. We are aiming to increase this number to probably 5,000 within the coming year. So our work include making diagnosis and the necessary pre-operative preparation and treatment, be it surgical or medical treatment, and then rehabilitation of all mothers following injury, birth-related injuries. Learning never stops, especially in medical field. We share experience from all over the world. People come to us, we share what we have, and people share to us what they do. So I think we are privileged to have this group of physicians. They have been very, very great in helping us, enhancing us what we know already. And I think we think this kind of collaboration should continue.
Every surgeon, every medical profession that has joined Muslim Aid on this mission has aligned their values with humanitarian care, with dignity, with khidmat, working to the best level they can. And they have come to give their time as volunteers for free. They have left their families, they have left their loved ones, they have left their children, they have left their creature comforts at home. And they have come for what reason? To help people in need. This is it. And this is exactly what we do. And inshallah, we will come again. But we need your support. If you want to support these missions, go to the website and make a donation. But together we can change the lives of these people. That's what we're doing. We're changing lives. collectively we can make that difference. But only together can we make this happen.